How our services have adapted has been overwhelmingly positive over the last 3-4 months. I think we can't underestimate how proud we are of what we do, our staff, our patients, our community, and importantly, all the services that support what we do. Particularly our administration staff, our cleaning staff, our corporate services staff that were delivering meals for staff. And the reaction from everyone was overwhelmingly, what can I do and how can I help? From both our community partners and everyone I worked with. So on the whole, incredibly positive experience, but I don't think we can underestimate the emotional impact on a number of people, including our patients, particularly in our mental health services. I was very struck by the compassion, the care, the diligence, the hours that people worked, the flexibility, that they constantly came up with solutions in every circumstance. So when we had to introduce beds in pretty much every conceivable place in Lymington Hospital and Romsey Hospital, Fordingbridge Hospital, we found space, we found the equipment. We had people right at our side throughout this experience and supporting us and making sure that we did the right thing for our patients and our staff and our community. So there were lots of challenges, but overall I think we have to just thank everyone, because from the bottom of my heart, from Jeremy's heart, Rachel and Ben, we all felt overwhelmingly proud of you and what you do. And we know that every day, but it's just nice to take this opportunity to say thank you.
Just wanted a few words regarding our response to the COVID pandemic and the teams and how they have responded and stepped up to the plate. Particularly our admin teams, who had to cancel huge numbers of patients and reschedule and try to manage and still come into work. Many clinical teams, including the MSK services, physio, orthopedic choice, pain, podiatry, that had to stop services altogether and get redeployed into either community teams or on wards in many instances. And this goes for the falls team and for endoscopy and various nurses and clinicians. It is amazing how everybody responded to what they needed to do. Services like radiology managed to continue throughout despite the pandemic, which is amazing. Our outpatient nursing staff has been managing people at the doors of hospitals, and our estates teams as well. For me, it is a huge, big achievement what everybody's managed to do. Finding spaces for beds that we didn't even know we had, working with other providers, UHS, Solent, PHL, to really make the best use of all our facilities, all our clinical experience, and all our expertise to make it safe for our patients. And I'd like to say thank you to everybody who has been involved. Thank you very much.
To say the last few months has been particularly challenging would be an understatement for everybody, I'm sure. However, having such a diverse range of services and such key services to deliver, being able to rely on staff to really go the extra mile and support people who are the most vulnerable people in our communities in a professional and exemplary way has been a delight to witness. We've had to make lots of adaptations, so lots of working from home via information technology that was unfamiliar at the start of the pandemic and is now business as usual, to ensure that testing for our patients was available at the very beginning when we had a lockdown of services in our most acute settings. So I would just like to say a huge thank you to everybody who has been absolutely fantastic within the division and worked tirelessly with compassion, professionalism and good humour. Thank you.
I wanted to say a really huge thank you to all our staff. One of the big things that hit me when the crisis started was this is a really big division, there's so much complexity, and is everyone going to be able to rise up and do all the things they need to do? And they absolutely did. I couldn't be more pleased with how everybody behaved and stood up to the challenge and got on with things. I think particularly I wanted to mention adult forensic services, because I know there's been a lot of discussion from other people about the other services. But in adult forensic services, we had outbreaks of infection in 2 of our services, and the staff are absolutely amazing. They got on and they provided the service. They undertook all the roles they needed to do with PPE and looking after patients and protecting them in quite challenging circumstances. And the infection was ultimately eliminated, and people were well and well looked after, and the staff were just brilliant. So thank you.
Over the last few months, you may have recalled there's something called COVID-19 that's come into all of our lives, and it has presented some challenges, but it's presented some real opportunities. The teams across Learning Disability Services have embraced and utilised electronic systems that maybe they wouldn't have done before. Really engaged service users who sometimes find it difficult to engage in different mediums and maybe sometimes face-to-face in electronic systems. They've required support from carers in their homes and families in their homes. So there's a big thank you to them as well about helping us engage with those service users. It's really important that we kept in touch. This is a vulnerable group. They have a multitude of physical health and other emotional and mental health issues. So to keep in touch with those guys, which we have consistently, has been really important. So I think what I'd really like to say across Learning Disability Services and to the NHS, thank you so much for everything you've done during this time.
During coronavirus, it's been a really difficult time for CAMS units, for the young people and staff. I think it was difficult getting used to all the new restrictions that came in around social distancing and having to wear masks. The particular difficulties for us were around changing the visitors policy and not allowing parents to come onto site or into the building, and of course for young people that's really challenging, and for parents it's very challenging too. So I think during that time it was particularly difficult for them, and I think we managed it as well as we could at that point, and I think the young people worked really hard as well to try and get through it, and they were really understanding, and the visitors and parents were really understanding as well. I think for the staff, they took on a lot of changes in a really short amount of time and really worked with it and just accepted everything that we threw at them, and really changing the way they worked completely in every way, from how we dressed to how we interacted with the young people. It was completely different to anything that we'd done before, and I think they did amazingly at it. And I think we're kind of coming through it now. They're bringing back a lot of the things we had before and getting a little bit more normal again. And I wanted to obviously say thank you really to all of the staff who have worked so hard to try and get us through this challenging time and continuing to give that high level of care that we've always given to young people within CAMS. So thank you everybody.
Well, what an exciting time we've had over the last 4 or 5 months. We started off in April being told by Public Health England that we needed to stand our services down. As you can imagine, that was really challenging for our staff. We wondered what were going to happen to the children and families of Hampshire. However, we very quickly realised the reason for it was that they wanted to redeploy our staff. We have really highly skilled, very well qualified public health staff. We're in the pandemic and it clearly needed a public health response. So our staff absolutely stepped up to the mark. Those of them who were able to volunteered, they used their skills, their knowledge, they upskilled as well, and they went off to work in other parts of our services who really needed them. They had a really interesting time. I think some of them had a really challenging time, but we all learnt and they learnt a lot from it. They really were amazing. What was more amazing was the response from those people who didn't go and do that for whatever reason. They were shielding at home or they were working in the office at base, because even though we were asked to stand our services down, we very quickly realised that the redeployment wasn't going to take all our staff. We needed to make sure our children and families in Hampshire got the support they deserved during this really challenging time. Can you imagine what it must be like to be a young mum and to be pregnant, to have your baby without the support of your partner? That happened to some of our mums in Hampshire. It happened to some of our families. Can you imagine as a dad not being able to be there for your partner? We know that was difficult. We experienced that for ourselves within some of our services, some of our own staff who are service users, but also our staff made sure they were there on the phone or with the use of Divisional. Wow, how much we've all learnt about digital offer, digital strategy, and how to use Zoom, how to use MS Teams, and even how to use the phone properly to do an assessment with a young toddler. So we've had a really interesting COVID period. It's been very challenging for our staff. At the same time, we've been mobilising our 3 new contracts. I'm really proud to say that our division has absolutely stepped up. Our staff have been amazing, and I'm really proud of them all.
One of the challenges we faced during COVID was sensory overload. We had information coming from everywhere. There was national and regional profiling saying that North and Mid Hampshire were going to be hit hard and fast with COVID. There were requests from the system saying you need to increase your beds. In physical health, they wanted our 18 beds to go up to 30, 40, then 70, and we did that. The head of nursing and head of ops, they got a team together and they made sure that there would be beds for people when they came through. We were also asked to have a mental health ward for COVID patients, and the team got ready, again, head of nursing Richard and the matron Chris, they got together and they made that happen, and they delivered and built that ward from the bottom up, and it was ready to go. We were also asked to produce a field hospital, and that was something we had never done before. So our project team, Vicky and Sasha, they prepared, they drew it on a whiteboard, and they were ready to deliver. It was incredible what we achieved. One of my greatest anxieties was infection control, making sure that all our staff and patients were safe. And we had incredible support from the Trust and from Jackie Hunt in infection control. We're really, really grateful to them. But for me, some of the unsung heroes are the community staff. We spent a lot of time focusing on inpatients, and it's quite right that we did. But the community staff put their plastic on over their uniform, and they went into houses, and sometimes those houses had heating on those hottest days of the summer. They're the unsung heroes. But to all frontline staff and all our corporate partners, thank you.
I think our COVID journey started around April, March time this year when we saw that it was going to be quite an impact to us on the system. Our initial was a reactive response around how we were going to help support patients in the community to keep those vital services going, but also how we were going to increase our beds on Anstey Ward, our community hospital, to support the step down from Hampshire hospitals around COVID patients that needed that rehab. So we initially did a scoping exercise to look at how we were going to increase those beds, and we went from an 18-bedded unit to 2 wards and up to 75 beds. Now thankfully we didn't need that within the Mid and North, and we kept the beds at 35 just for subacute medical care and COVID step down. The ward has now since gone to a 28-bedded unit looking at rehab. The ward team have been through a massive transformation around all of those changes that we had to adapt to around PPE, changing guidance in that, as well as the changes of patients that we had through. So we were seeing a younger cohort of patients for rehab, which the team haven't normally been used to, and they've done really well in coping with that. We've also had huge support from outside services such as MSK physios and school nurses and health visitors to be redeployed to our ward to help increase the staff that we needed. Our community teams have been through a huge journey as well, with our specialist nurses, community nurses and therapists really wrapping their services around the patients. But also we've had a real opportunity to work with our outside partners, such as Hampshire hospitals and primary care networks, to really work as one team. And the teams have been for a real transformational journey around creating that one team model and making sure that the right person is seeing the patients in the environment that they need. Without all the support from all the teams and all the staff, I don't think we'd be on the transformational journey that we are today, and I just want to say a massive thank you to everyone.
The last few months has been a really challenging but also really hope-instilling time in the city. I've never seen so many people rise to the challenge of delivering care in new, dynamic, flexible ways and making sure that we put our patients at the heart of everything that we do. I've been really impressed in a couple of places in particular, such as our community care, how we've managed to make sure that people receive care when they need it, how they need it, but also adapting to the fact that we've not been able to see them face to face, how staff have adapted to virtual technology, and how people have embraced that and have made a real difference in our patients' lives. The other area where I think we've done a fantastic job is working alongside other parts of the wider healthcare system in Southampton to deliver a particularly good crisis response. We've worked well with the Acute Trust at Southampton General, with our council colleagues, and with Solent, the other trust who run community services in the city, to really form the beating heart of the city and make sure that people have got the care as and when they've needed. Our staff have been so fantastic, working in new ways, in new places, and delivering care in all sorts of different ways that we would never have expected 6 months ago. It's been really, really, truly humbling to be a part of that.
When I think about what's happened over the last 2 months, I have to take a breath and be really proud and impressed of everything that has been achieved by the teams. They've been absolutely outstanding. Every challenge that they've faced, they've delivered against. There's been significant changes asked of them in their roles, in the times that they work, and just generally how they go about doing things. And they've risen to the challenge every single time. I'm so proud of all of our staff, and there are so many things that I'd like to talk to you about that they've done. Some of the key areas they've focused on is around supporting the system. One of the big things that we knew we needed to do was help manage patients' flow out of the hospital and support people to be at home. The teams have worked incredibly well in physical health and mental health services to think of new and innovative ways to engage with our patients and service users to ensure that they're safe, the most vulnerable are being cared for. They've gone above and beyond on all levels. So I just want to take this opportunity to say a heartfelt thank you to everybody across our physical health services, our mental health services, our corporate teams. I'm sure I haven't mentioned everybody, and I apologise for that, but each and every one of you have been absolutely amazing, and you make us so proud, and you've done so much for all of our community. So, as I say, a heartfelt thank you from all of us at the division in the Portsmouth and South East Hampshire.